Talking about Angelina Jolie's revelation that she underwent a preventive double mastectomy earlier this year. Joining me tonight, Congresswoman Karen Bass, Democrat from California, who worked as a physician assistant for nearly a decade. And here at the table, Lizzie Stark, journalist and author of forthcoming book, Pandora's DNA, How the Breast Cancer Gene Changed Everything. Lizzie underwent a preventive double mastectomy at age 27. Great to have you both here. And Lizzie, I want to begin with you. Having gone through this, reading the op-ed today, what was your takeaway? What was your reaction to it?
Well, first of all, I just really feel for anybody who has to make the decision, make the call to have a preventative double mastectomy. So my first reaction was sympathy. I also think that it's great. It's going to be great for women who are thinking about testing for the gene, right? This raises awareness about hereditary breast cancer, and it can help women decide whether taking the gene test is right for them, of course in consultation with a genetic counselor or a doctor. And then I also really liked what she said about not losing her femininity. I think that's a really important message, not just for BRCA women who've had a preventative double mastectomy, but for many women who've had a mastectomy, that there is life after mastectomy.
You found yourself in the position, you did genetic testing, you found that you had this, and I should be clear, I was slightly erroneous before. It's a mutation on that gene. Everyone has that gene. It's a mutation, a fairly rare mutation. I just can't imagine what goes through your head in making that decision. It seems like the starkest kind of risk management for an individual to face.
Well, there's the decision to test, and then there's decision what to do about the results that you get. For me, I come from a family with a lot of cancer in it. My mother had cancer at 30, her mother had cancer in her 30s, and again in her 40s, and then ovarian cancer in her 50s, and both of her sisters died of cancer. One quite young, in her early 30s of breast cancer, the other one survived breast cancer to die horribly of ovarian cancer. So I think that's one thing that...
It was just so stark looking around your family.
Yeah, every woman on my mother's side of the family has either had her breasts taken off voluntarily or because she's had cancer. Wow. So, you know, when you have that kind of odds, it really does feel like cancer's coming for you and that you have to be extra cautious.
Congresswoman, I couldn't help but note that that $3,000 is the cost for just the genetic testing that Angelina Jolie underwent and that Lizzie underwent. That is a lot of money. That is not something a lot of people can afford, and it's not necessarily covered by insurance.
Well, absolutely, and let me just say to your guest, you know, I really think she's very brave, and I really appreciate her coming forward and talking about this. When I watched the news this morning, you know, the first thing that came to my mind, I have to say, is I said, I lost 2 maternal aunts to breast cancer, and I was like, wow, maybe I could get that test. At $3,000, that's just the screen. Then you're talking about the mastectomy, and then most important for women is the reconstructive surgery that comes afterwards. And I am sure that that really is a barrier, you know, in 3 areas: the cost of the screen, the surgery, and then the reconstruction. And so, to me, as we move forward implementing healthcare reform, I really want to look forward to the day that all women have access to this test, to the surgery, and to the reconstruction that happens afterwards.
It may be worth noting that my test was not $3,000 because they tested my mother first, and so instead of having to sequence my entire genome, they only had to look for the part that they only had to look to see if my mutation was the same as her mutation.
This is a really interesting statistic on this. White women are almost 5 times more likely to undergo BRCA 1-2 counseling than African American women. So there's a massive racial disparity. That massive racial disparity also reflected in the fact that black women had a 41% higher mortality rate and lower incidence rate than white women from 2005 2009. So there's some real equity issues around this. There's also this, I mean, this to me is the most striking aspect of this. There is a single company that owns this gene. And if it sounds like I'm misspeaking, I am not. There is a single company, even though they did not make this gene, evolution made this gene. Myriad Genetics has patented the gene. They have claimed that they can patent this gene. A district court told them that's crazy. An appeals court said, no, no, you can't. It has been argued before the Supreme Court. We will find out soon. But this is really something, that this technology is right now in the hands of one company, Lizzie.
Yeah, that it's incredibly extraordinary. I'm really looking forward to seeing what the Supreme Court decides this June. My understanding is that what Myriad has patented is the genetic sequence in isolation. They're arguing that you can't patent things out in nature, and so they haven't patented a whole string of DNA. They've just patented the specific cancer-causing mutations on the specific genes.
And that's a real question, whether they can do that. Congresswoman, this is a case I think you've been following closely.
Right, absolutely it is, and it's a case that we're also following in the Judiciary Committee to see, what the outcome will be. Again, you would think that something that would save lives in such a manner really should be opened up, and there should be access to everyone. It's difficult when you're thinking about a disease that you would hold on to a patent for X number of years before you provide access to the general public. I think it's something that we should address in the long term.
There's been a big question, and Lizzie, you're researching this. How much are we going to see this increase over time? We've already seen a huge amount of increase. Are we going to see an explosion in this kind of testing, and are we going to see testing in all sorts of other areas like this?
I think so. We're learning more about genetic causes of disease every day, is my impression. There aren't just genes for breast cancer. There are genes that can raise your risk of Alzheimer's or of colon cancer or of,
Right.
So I think that what we're seeing now with BRCA women is going to become much more widespread. I think this is some part of the future of medicine, and it's complicated and it's uncertain, and that's one of the really problematic things about genetic testing.
So the first-person experience that Angelina Jolie, I thought, laid out very movingly today, that you yourself have experienced and had to act on, looking down the barrel of genetic probability is something I think a lot of us are going to be experiencing for ourselves. Author and journalist Lizzie Stark and Congresswoman Karen Bass, thank you both so much.